thanks also to Toni Millar and the other leaders of the Pediatric Disaster Medicine Special Interest Group. We're just so delighted to bring you this talk. Toni Millar is a certified child life specialist. Her clinical work in the field began in the pre and post-surgery areas at Rainbow Babies and Children's Hospital in Cleveland, Ohio. From there, she took on a leadership role for the Child Life Department. And while there, she was asked to lead the Child Life Department at New York Presbyterian Children's Hospital in Manhattan and eventually became the vice president for patient-centered care. In 2021, she shifted gears and reprioritized her work-life balance and became the program development consultant for the nonprofit Child Life Disaster Relief, where she leverages her experience to help the organization's growth and to reach children in disaster with child life experts. Toni, thank you so much.
Oh, you're welcome. Thank you for that introduction. And hi, everybody. I'm so glad that you could join us today. I'm going to start off just briefly with the objectives for the presentation today. If you're not familiar with child life already, I'm hoping that you'll have an introductory understanding of the role of child life in medical settings as well as disaster settings. Also, I hope to introduce you to the effects of trauma on children who have been affected by disasters, and you'll gain a practical but introductory knowledge of how to connect with children in disasters and crises. This information is intended to be just a beginning, but it's also meant to be practical, effective, and evidence-based, and immediately applicable. So let me tell you a little bit about Child Life Disaster Relief. I'm going to play a video for you. Katie Neese is one of our founders, and it's going to tell you a little bit more about the organization.
A lot of people will say kids are resilient, but there's a difference between resilience and vulnerability. Kids are resilient, but they actually are also the most vulnerable, more vulnerable than adults to the long-term negative effects of disastrous events. And it's that vulnerability that begs the need for trained professional intervention in the midst of the chaos. The mission of Child Life Disaster Relief is to empower and support children and families in crisis by integrating child life professionals' services into impacted communities. Child life specialists use play as a tool to help children process and express their feelings of the experiences they have and explore emotions that are new and foreign to them. Child Life Disaster Relief has seen a huge increase in the amount of requests sent our way for our involvement. Due to that, there is a huge need on our end to have funding to be able to say yes and respond to those requests. No child should go without the support and connections needed to start that healing process after disasters.
So just to build on what Katie was talking about, and you can see our mission and vision here, our profession as child life specialists is really our expertise in child development is really what is the foundation to support children after disaster or crisis. Child Life Disaster Relief volunteers go through extensive disaster training that helps bridge that gap between their child life skills and the realities of responding to a disaster. They also undergo a background check before deploying. This ensures that Child Life Disaster Relief provides consistent, safe, evidence-based, and trauma-informed care to the children they serve, and it's what other organizations have come to expect from us. So with this, you can see we're kind of a multifaceted organization. So in addition to deploying certified child life specialists to respond to disasters and work with children and families, we collaborate with other disaster-related organizations across the United States. And I'm going to go into that a little bit more in a minute. We maintain a comprehensive database of our trained response-ready certified child life specialists to deploy them literally or hopefully within the first 24 to 48 hours. Per request from first responders and professionals who care for children, Child Life Disaster Relief has created trainings to help them feel more confident and competent in their interactions with children. Now let me tell you a little bit more about child life specialists. So you can see here our background and our education and training. We are bachelor's or master's prepared. The focus is on psychology and child development. We then do clinical training in a healthcare institution, and then we are eligible to sit for a certification exam. Once we pass that exam, we do need to recertify every 5 years with continuing education credits that are in different categories. Our role and purpose is to utilize professional, developmentally appropriate psychosocial assessment techniques to provide interventions, including play, focused on mitigating negative effects of stress and trauma and maximizing coping and mastery for children and families. So taking a look at these two slides, the one on the left, you see a child life specialist in a medical setting offering one-on-one interactions with a child. The field of child life actually has its roots in the 1920s when physicians began to notice negative developmental outcomes for children after hospitalization. Throughout the mid-1900s, professionals specializing in mitigating trauma in healthcare began to emerge, and in 1982, a formal professional association was established, uniting these professions and forming professional standards. We were originally called the Child Life Organization, and now we are the Association of Child Life Professionals. In the picture, if you could look to the right, you can barely see the person, but there is a person that has a white mask on where the arrow is, and that is actually the child life specialist. She's part of the emergency department team, and in the trauma bay, her role is to be at the head of the bed beside the child's head, where she can explain in terms the child can understand what's happening, as well as offer coping techniques. The team relies on her to be kind of the one voice, which is a practice that we use, to communicate and offer support to children while the rest of the team is focusing on the medical needs. If a child life specialist is not available, it's important to assign this role to a parent if they're available and they feel like they can do the job, or to another member of the team. This decreases trauma for the child and increases the ability of the team to provide essential medical care. So looking at these skill sets, so a big part of what we do is building trust when you need to make a connection. So building trust, providing developmentally appropriate explanations and communication, acknowledging emotions, providing coping techniques, child-directed play, and incorporating trauma-informed care. These are all foundational to child life specialists and are not only valuable inside medical facilities, but they're also valuable in non-traditional settings and disasters. Now let's talk a little bit about the effects of disasters on children. So you could see this list. I'm just going to point out a couple of them. Hyperarousal is one I want to talk about, where the individual has increased sensitivity to stimuli, such as noises, smells, anxiety, and sometimes hard to be with others. And they may or may not present with hyperactivity, but either of these after disaster often represents a child whose nervous system is stuck in a heightened state. And development of new fears and separation anxiety are also common. And these two bring confusion and frustration for parents who often have the limited capacity themselves after a disaster to have the sensitivity to attend to the emotional needs of their children. All of these reactions are normal, but often can be very upsetting to adults who may misunderstand the why behind these emotions. Those who interact with children who have experienced a disaster will become more effective in connecting, communicating, and supporting children if they understand that these are all behaviors or outcomes that are typical post-disaster. Often a child's behavior after trauma, especially if the child is quiet or goes on with normal activities, may be misconstrued to think that the child has not been affected by the trauma or the disaster. But those of us in this presentation know that even though a child might be quiet or perhaps playing and continuing on with regular activities, doesn't mean that they're okay. It's important to have trained professionals interacting with and providing psychosocial support for these children. In the last century, evidence further emphasized the need for professionals mitigating trauma in healthcare for not only the developmental, emotional, and mental health of children, but also for their physical health and outcomes. So we all know language matters, but when you're in the heat of things, it's really hard to remember that. So one of the things that we do is when we're working with children is we try to remind those working with them is that what you want to project is calm and reassurance, and try to provide as clear and understandable directions as you possibly can. When we're doing training for first responders or parents and caregivers or professionals working with children, they're really eager for examples of simple evidence-based techniques that they can use to promote positive coping and build resilience. So that's what we're looking at today. So instead of shouting at someone, "We can't stay here, it's dangerous," calmly you would say, "We're going to move somewhere safer." Instead of saying and screaming at someone, "Calm down," which I don't think anybody on this call calms down when that happens, "I'm having a really hard time understanding you." And if you have the time to say to them, "I'm going to sit right here with you. Let's take a couple breaths together. Take your time and then try again and tell me what you're saying. Don't move from here. You're doing a really good job keeping your body safe by staying right in this place." So there's definitely a difference in being able to do that. All right, so in addition to language and being able to project calm and reassurance, think about your body language as well. So you can see in all three of these pictures, the first responder is doing something to try to connect with the child. So in picture number one, they're bending over, but you can still see a significant height difference. And if this person has any equipment on their belt, possibly even a pistol, it's right at that child's eye level. The second one, so the firefighter has the equipment on, but is doing something that's familiar, a high five to the child. So they're trying to engage with each other. The other thing that if you work in medicine, you probably already know this, but I think COVID taught us everyone to do it. If you can't see someone's mouth, look at their eyes, and they have smiling eyes. So that helps as well. And then the third picture, you can see that the first responder is actually a step down. So not only kneeling down, but a step down, and they are engaging. So of the three, most people say that the third picture is really the one that seems like there's most connection made. Now I want to talk a little bit about the power of play. Unfortunately, the importance of play can still be undervalued in today's culture. However, its powerful impact is undeniably special and important, especially in situations where there's a lot of high trauma. So foundational to the profession of child life and aligned with the 2018 American Academy of Pediatric publication, Power of Play, a pediatric role in enhancing development in young children, Child Life Disaster Relief provides and encourages child-directed play opportunities to help mitigate stress and build resilience after a disaster. So we have what we consider play on the go. Play on the go means our responders carry backpacks that have essential distraction and coping materials so that we can help a child or multiple children out in the field or even in a shelter setting. Each backpack has appropriate materials to help children of all developmental ages, as well as children who are neurodiverse. However, child life specialists don't always need toys. Our expertise in child development and meeting children where they are, as well as our ability to connect and improvise and provide play opportunities, are tools that we can use anytime and anywhere. So here are typical ways to be able to use play. The children on the left are utilizing a center that has been created for them, but typically there is not much room in a shelter. And so what Child Life Disaster Relief does, it comes in and working with whoever is organizing the shelter, we create a play space. It might just be a corner, it might be an aisle, or sometimes larger. And the play spaces have developmentally appropriate activities for children who have relocated to the shelters, as you can see again in this picture. As children experience new and big emotions, they need opportunities to express themselves. So paper and crayons, writing a letter, drawing, painting are all ways that we can do this with them. And again, we like to have it child-led. So they provide and encourage child-directed play opportunities to help mitigate stress and build resilience after a disaster or crisis. I can't tell you how many times we have like these building blocks, and the kids will build the tower and they'll knock it down, and they'll build the tower and knock it down. And it's actually sometimes disturbing for adults, but it's actually helping the children kind of process what has happened with them. So sometimes it's very noisy play, and we are great with that. When we were helping out with Hurricane Ian, our child life disaster relief volunteers were able to respond quickly while our collaboration organization, the Red Cross, was still mobilizing. So we provided activities in a few of the shelters that were set up, and also supported parents who were struggling to understand and help with their children's fears and behavior changes. Children's Disaster Services is an organization with whom Child Life Disaster Relief has a formal partnership, or MOU. They were then able to join a little bit later on in the work. And when they joined at the shelters to ensure continuity of care and support, we provided play sessions together before our Child Life Disaster Relief volunteers departed. So I want to talk a little bit more too about the importance of other disaster organizations. So this looks like an eye chart. It's really meant to give you an overview of the different types of collaborations. We do hesitate to use the term partnership unless we actually have an MOU with someone, which we do have with Children's Disaster Services. We also have foundational collaborations with Camp NOAA, the Red Cross, and Save the Children. I'm also a member of the American Academy of Pediatrics Council on Children in Disasters, and we are national members with the VOAD Association, which stands for Volunteer Organizations That Aid in Disasters. And we're also liaison members with the National Pediatric Disaster Coalition. So what we try to do is utilize these blue sky times to build these relationships and build the cooperation and communication, so that when a disaster occurs, support is more coordinated, more comprehensive, and more successful. And so as a disaster happens and communications start, and people are focused on logistics such as medical care, shelter, food, and financial support, some of our organizations work together and try to coordinate the mental health and psychosocial support for adults and children. Let me tell you a little bit about our resources. So feel free to utilize this QR code. This will take you to our website and our resources page. What's great is that you can utilize the resources there on your phone. You can bring them up, or you can print them out, such as the disaster specific sheet that you see right there. So what we do is, when we have our resources, we always make sure that they're evidence-based. We want to make sure that they're free. And we get, sometimes we utilize resources from other experts that have done the work and said, could we please put that out there as well? We also try to make sure that we have this QR code on our name badges when we are deployed to shelters or out in the field, so that it's available for others who are in the field to use, or even parents and caregivers. So it's been very helpful. I also want to talk a little bit about our reference guide. Oops, excuse me, I went the wrong way. So our developmental reference guide was actually created by a child life specialist at the request of a friend way back a few years ago, when people were deploying to the Gulf War. Her friend wanted a quick guide how to understand and support children that he might encounter. So she created this guide, and it was originally called the Pocket Guide because it was long and thin to be able to fit into the pocket of military field pants. Since she created this, it's had many updates to ensure the information is current. And what you're going to see here, I'm going to go through, is each developmental stage. We've broken it into 3 sections. There are developmental considerations, there are potential stressors, and then there are suggestions of what you can do as a caregiver or someone interacting with the children. So we saw infants, we also have toddler. And again, this is on our website, so I'm going to go through it for sake of time, but you can have access to these. We have younger children, we have older children, we have teens, and then we have neurodiverse children. Now I'm going to move on to the 5 essential needs of children. So in In 2007, Stephen Hopfel and other experts co-authored an article in a psychiatry journal entitled 5 Essential Elements of Immediate and Midterm Mass Trauma Intervention, Empirical Evidence, where they identified 5 principles for intervention when working with children after disasters and mass violence. So our work with children and families, as well as our trainings, take this information and expand upon it in our resources as well. But for a particular moment for now, I'm going to have each one of you look at those 5 essential needs and imagine that you have just experienced a disaster yourself. As you look at the words, which one feels most important or stands out to you? And not everybody's going to have the same one. In that same way, try to keep in mind that when you're working with children who've been affected, what's most important to them, whether it's safety, connection, regulation, self-efficacy, or hope, it might not look the same for all children. So you really have to individualize how you interact and connect with kids. So just kind of keep that in mind. Often the best of us can get overwhelmed with what kids needs in these difficult moments. And so we've actually created a trauma mitigation model to help responders feel more confident and competent as they're working with children. Now I want to switch gears and talk a little bit about some of the recent deployments that we've done. Our deployments traditionally were on site in person, but with COVID, as well as some disasters that have happened that the sites are not safe, we have utilized virtual. So I'm going to tell you a little bit more about that. I talked a little bit about Hurricane Ian. So that was a on-site in-person deployment. But let me tell you a little bit about the work that we did for the Maui fires. We were actually contacted by local professionals in Maui who cared for children and knew about child life skills. So with their guidance on what information was really needed most from the community, as well as getting cultural guidance from them, we provided virtual trainings on September 30th of 2023 to help adults and caregivers understand the why behind what they were seeing of children's behaviors and how to help them mitigate that trauma. We got great feedback, and we're actually currently talking with Maui again, our contacts there, to explore additional requests, some which will be virtual and some will be in person, to support the ongoing needs of the Lahaina children and their families. One of probably the biggest virtual deployment we did is shortly after the war in Ukraine broke out. There's an orphanage there who has someone who supports them and knows about child life disaster relief, and so kind of brought us all together. And the person had heard from those who care for children in the orphanage, are called teachers there, said the teachers were really having a hard time with what they were experiencing prior to the war. The children who were at the orphanage were children who had behavioral issues, they had physical challenges. And so now as children were joining the orphanage, they were seeing, the teachers were seeing behaviors that they didn't know how to help the children with. And so we did a 3-hour initial training for them. We utilized a translator. So it was also for us learning how to do in small sound bites the most pertinent information. And we did a training for the teachers so that they'd understand the effects of the trauma and the behaviors that they were seeing, as well as we gave them evidence-based, developmentally appropriate suggestions that they could implement. I actually sat in on that session, and at the end, it was extremely moving. The teachers were crying, and they said, we thought we were doing something wrong. And so they were so glad to be able to have these skills to work on. To follow up with that, what we did then is broke the children into 3 developmental stages. We did a 1-hour work session with the teachers, with the children, using a translator, and virtually deployed our child life specialists to help them, the teachers, understand how to use materials. We had the benefactor of this orphanage had asked Child Life Disaster Relief to give a list of what are some materials that might be helpful for the teachers to have at the orphanage. So weighted blankets and sensory toys and things like that. The benefactor got those over there. And then what we did is we taught the teachers and children to use those materials together. So we are actually in conversations with them to do a kind of a part 2. Sadly, they have had more children come to the orphanage, and they've also had some new teachers. So we're in conversations about that as well. We do also get asked about our expertise. And so there is a group from RAPM. We in the disaster world love our acronym. So RAPM stands for Western Region Alliance for Pediatric Emergency Management. It's comprised of emergency responders, physicians, mental health specialists, and disaster experts. They won a FEMA grant to create a 2-day seminar with modules highlighting the roles and responsibilities of various experts who would be supporting adult and children disaster survivors. This information would then be used to create a disaster handbook to be used by FEMA, and RAPM recognized the importance of including child life expertise. They knew about Child Life Disaster Relief, and as a result, I was invited to represent Child Life as well as Child Life Disaster Relief to be included in this important work. Here's some other requests that we've gotten. Child Care Aware is an oversight organization for child care centers and providers. They often do trainings for those providers. So they requested that Child Life Disaster Relief review and make recommendations for their curriculum as well as resources. We had 2 wonderful opportunities for the American Academy of Pediatrics. In March of 2023, we did a presentation regarding disaster preparedness and response for children with complex medical needs. We did that in conjunction with the National Pediatric Disaster Coalition, a parent of 2 children with complex medical needs, and a community caseworker. This led to another American Academy of Pediatrics member inviting us to present this topic again at the fall of 2023 for the UCSF Benioff Oakland Children's Hospital for their medical grand rounds. And then in March of this year, I actually presented a Child Life Disaster Relief overview, which led me to talk to you guys today, which I'm very excited to be doing. We also got an invitation from the Executive Office of the President, the Office of Management and Budget, inviting Child Life Disaster Relief to a 2-day convening titled Building a Trauma-Informed Approach to Disaster Recovery. It's going to take place in a couple weeks in Washington, D.C. And I'll be totally transparent. When we first got this invitation, we thought it wasn't real, but it's real, and we're very honored to be part of it. And then we're also in discussion with Family Voices of California, National Pediatric Disaster Coalition, and possibly some other entities of doing a webinar series, again, on the topic of disaster preparedness and response for children with complex medical needs. If it happens, it might be late in 2024 or early 2025. So I'm just going to touch on this really quickly. I've mentioned it a couple times because we have gotten multiple requests from first responders and professionals who told us that their work mostly involves adults and that their training really doesn't include information about how to connect, communicate, and support children who have experienced disasters. The Child Life Disaster Relief has created 2 tiers of training, both with the option of customizing to fit the needs of the audience. So our basic training is an overview of Child Life Disaster Relief and our trauma mitigation model, along with practical skills to be able to utilize in the field. The advanced level is more in-depth review and application of our trauma mitigation model, as well as tabletop exercises. If this is of interest to you, feel free to email us at info@childlifedisasterrelief.org. And with that, there's that information again. If you need our contact information, info@cldisasterrelief.org. Or if you just need the QR code to our website again, please take a look at that. And with that, maybe I'll leave that up and I'll switch gears to answering some questions.
Wow, Toni, thank you so much. Folks, if you have questions for Toni Millar, please put them in the Q&A. I think we'll get started uh, while we wait. I think you've answered my question already with this
Okay.
lovely contact information.
Okay.
But I think I'd like to add on a little tale of um, if our audience is looking for more than training or looking for your organization to potentially um, be part of the planning for their response or their response itself, is
Mhm.
this still the right way to get in touch with you all?
Yes, this is definitely the best way to get in touch with us, and just indicate, obviously in your email what you're looking for, and we will get back to you. If it's a high priority, if it's time sensitive, please put that in the subject line too, so that way we do get multiple requests, and obviously there are times when it's very time sensitive, so we wanted to get to those requests first.
Thanks, Toni. I have had a few questions in the chat, which I think are probably pretty similar that I've caught up, excuse me, pretty similar to each other. And people really want to know how to get involved in your trainings. And I think specifically, do you have different trainings for different levels of medical professionals? Are they kind of all a consistent training? And they just want to be more involved and learn from you. And so maybe if you could share a few more details on the trainings, what that looks like, the different options for them depending on their medical training.
Absolutely. And thank you for that question. So the training that right now, if you go to our website and it says training, that training is actually to transition certified child life specialists to be able to be deployable. However, we are going to be adding on to our website the trainings that I was talking about, what we refer to as confident and competent. And that could be for anyone, whatever their medical. Oftentimes, we've been asked, maybe there's a grouping of emergency medicine physicians or faculty to be together, and we might do something for them. And that's why we individualize it. So learning about who will be the audience, we talk with the requesters and figure out, do they really, are they ready for the advanced, or do they want to start with the beginning first and then move to advanced? So we don't have a one size fit all. We have a one size fits everybody type of model. I hope I answered that. So if you go to the website, you will see trainings right now. Those are just for child life specialists to be responders. And if anybody is on as a child life specialist and you would like to do that, we would love to have you.
So it looks like there are a few that would like to do those child life specific trainings.
Yay.
There are some people in the chat who'd like to do some of the deployments with you. So I'm not sure if they reach out to you, would that be the way to get involved if you're looking for more assistance and more deployers?
Yeah, so we actually only deploy certified child life specialists. So if anybody is interested in deploying, yes, please just continue to use the info@Child Life Disaster Relief email with your requests. And what we'll do is reach out to you individually to see what works best for you. We also know that if people become, they want to be a deployer, life happens. And so, they may not be able to deploy for every request that we have. And so we have a broad group of people that we pull from. And sometimes somebody may have just, started a young family and they can't deploy, but they really want to do trainings. There are ways to get involved and do that as well.
Okay, wonderful. A couple more questions that were related to, I think, some of your content. Do you have content that may be applicable to those that work in refugee camps or work in international deployments? I know that you do some international deployments, whether they're virtual or in person, but they're wondering about some cultural and ethical considerations for those children that they're serving as well.
Sure. So everybody who works for our organization, for the most part, is a volunteer. And so what we have tried to do, I'll use Ukraine as an example. We actually worked with people who volunteered their time as translators, not only to help us do those virtual sessions, but there were quite a few children from Ukraine who were coming to the United States for treatment. And so we worked with people to translate information, basic things about how to ask for a child life specialist, also culturally helping the child life specialists in the US understand culturally what was important to the children that they were going to be seeing. So we kind of, excuse me, as needed, have the ability to do that. And so if people are requesting work with different children in different areas and they need things translated, we would need some help with that. But we always work with whomever is on the ground to serve as our cultural guides so that we make sure that the way we're interacting and the information that we're providing is culturally appropriate.
Wonderful. And then there was a question about the ages. It looks like that some of those bags that you had shown pictures of for small children, maybe school-age children, do you have some training that focuses on that teenager, kind of young adult, transitional age?
We do, and the backpacks have a couple things in there. They're not meant to be we can carry everything in there. So depending on when we find out about or are requested to join in a shelter or we're going out with an experience. So for instance, if we are going to continue working with Lahaina and Maui, we're working with someone who may actually have us go out in the field with some medical personnel for people who are displaced and are not living in shelters. And so we're going to need very different types of things to interact with them than we would if we were in a shelter and we had crayons and paper. And so I think we are able to be nimble in that sense and be able to have supplies that are available. Sometimes too, we can't always, not every child life specialist who works with us has one of those backpacks. And so a lot of times we'll work with like Save the Children or Red Cross or whomever, and we'll say, if we give you a list, and then they work with Amazon and they get supplies brought in. So there are a lot of different ways to get what we need to meet the needs of who we're working with.
And could you give some examples of support that might be offered to these young adults in addition to just like backpacks and supplies, and how to interact maybe with them on their developmental level?
Yeah, definitely. So we don't hand them the backpack. We have the supplies to kind of be out, and then we let the kids direct it. And we do the same thing with the teens. What we don't do is say, draw me a picture of how you're feeling, because they may not be at that point and maybe they don't want to share how they're feeling right now. So instead we utilize our skill set and be able to just have the materials there and be available and listen. The biggest part of what we do is listen. And if they start to tell a story, we listen, and we might ask questions or just indicate that we hear them. Sometimes you just need to be heard when you're telling your story. So it depends. It's hard for me to generalize because it really depends on who we're working with. But we take a lot of our cues from the person or people that we're working with.
Wonderful. Leah, did you have a question?
Yes, I wanted to thank you for this great presentation, and it was lovely meeting you.
Lovely.
And I wanted your advice on the post-disaster communication with children. Mainly, the pediatrician meet them in this phase, and if you have any special advice in this to this post-disaster interaction with the pediatric population.
Yeah. A general thing would be is to, I think we all do this, so it's not just pediatricians that do this, but I think we all do this as caregivers, trying to do our best to help. Sometimes we fill the space with our own words rather than waiting to hear the words from the person. And by being able to maybe pay attention to, other key things that are they having a hard time with? Are they hyper aroused? Are there other things that are going on? Asking the caregiver, what seems different? And if it's an older child, how are things feeling for you today? But you're not necessarily asking them to go into psychotherapy and tell them your feelings, but just, have you noticed it harder for you to read? Is it harder for you to concentrate? Asking questions that will probably start to send you cues as to know what the next question would be. Does that make sense?
Yes, definitely. Thank you.
You're welcome.
I have a couple more questions from the chat. Let's see. Could you share the hardest part in managing pediatric patients in a disaster and how you manage that?
Sure. Well, I'm going to get a confession here. So I'm way too old to deploy. So I have not deployed myself. However, I work with our childhood disaster relief volunteers and leaders. So what I will tell you, I'll answer that by what they have told me. But if you could repeat that again, because I'm not sure I heard all of the question.
Yeah, it is the hardest part in managing pediatric patients in a disaster and how you would manage it,
Okay.
how you would respond to them.
Okay. I think, well, I think if there are various languages that, and there aren't translators available, that's always kind of a challenge for us. But play seems to be, you know, it levels the playing ground for everybody, not to say a pun, but it really is, play is just universal. So if we offer play and we can watch what's happening, the language becomes less difficult for us because we're using the language of play. If that's not available or there are different situations, I think probably one of the hardest things for us working with children in after a disaster is, I think a lot of people, it's really hard to see kids struggle. And so a lot of people just kind of want to fix it and, you know, gonna go on. And this is a long process and it looks very different and it can look very messy for a while. Kids are very dysregulated for quite a while. And so it's also helping the parent or caregivers so that they understand what they're seeing, helping them kind of start to regulate themselves so they can help their child regulate. So I mean, gosh, the list is long if I'm trying to imagine all of the stories I've heard, but I think those are the key things, no matter what the situation is to really meet people where they are and to utilize play as much as possible. And a lot of times the adults start playing too, because they're trying to mitigate their trauma. And so being open to what it is that they need rather than trying to maneuver it and manage it.
Thank you. A couple of other questions. It looks like a lot of your trainings are on Saturdays. Would it be possible to also host some on other days, such as on Sundays? And would it be best if they just contact you maybe, and if you needed to set up alternative training times?
That would be fantastic if they would contact us. There is not one time that we have hit on, and we continually, you know, ask people what their preferred date is. And we know that people can't always make a Saturday. So we are trying to offer a variety. But if they would like to call us and give us feedback on what works best for them, we generally, for us, we really need a kind of a minimum of a group of people, rather than we're not going to do a 4-hour training for a one-on-one. So if somebody has a really hard time right now being able to do any trainings that are on a Saturday, we don't want to hold them back. They can start to do the self-training modules, and then we will look at expanding our 1-hour live training for that component of it. And we're also trying to find more ways for the 4-hour. It's just that the child life specialists who teach it are child life specialists during the week at their jobs as well. So we're working on that. But thank you for bringing that up.
Thank you. Another person had asked if there were a list of items that you put in your play backpacks that others could use to duplicate.
Sure. We do have a list. If you reach out to us and just indicate that in your email, we're glad to send you the list of the materials that we utilize. I think most of them are from Amazon. And so we'd be glad to share that with you.
Okay, thanks. Does your approach include some kind of emergency schooling like UNICEF, or is it more focused on individual needs?
That's a good question too. It's really more based on individual needs. when I mentioned childcare aware, they're different from UNICEF, obviously, but the idea is that here are caregivers working with children who have been affected by disaster. So what we do is we've actually done trainings for the adults, the teachers, to do that type of thing. But we right now focus ourselves mostly on individual needs or small group types of needs.
Okay, wonderful. If you have any experience with approaching children who lost their limbs during disaster, can you share it? Would you do anything differently, I guess, depending on the types of injuries that the children may have sustained?
Yeah. I have not, as I was saying earlier, and I'm really trying to think if I have heard any stories from my colleagues. If I could ask whoever was asking that, I know other people probably want the answer to that too. But if you could contact us, I'm going to put you in contact with our deployment child life specialists. They're the ones who oversee the deployment, and they may have better, through their experiences, they may be able to give you a much better answer than I could guess at right now. So if you don't mind, contact us about that.
Okay. Let's see. To attend a training, is there a prerequisite to have a medical degree or background? Do you accept EU residents once trained to be deployed in case of needs? And I think this goes to there is training specific for child life specialists, but I think looks like a large desire here on this call for you to expand that to other medical professionals.
Well, being an organization that just deploys child life specialists, I don't think it's right now in the strategic plan to incorporate other. However, that's why we created a lot of these trainings so that we can train other people to do the work that we do. So if that's something that you're interested in, we'd be glad to do kind of a train the trainer for you. And right now, we have only done virtual deployments, as I was talking about with Ukraine, outside of the United States.
Okay. Ryan Good from Canada is part of a disaster psychosocial support team in British Columbia, and they're wondering if someone from your organization would be willing to present to them and their partners as they're facing wildfires currently.
Yes, please contact us. And again, I'll give it to our deployment coordinators and they'll be able to respond. If they're in an area where there's currently a disaster, a wildfire occurring, please indicate urgent in the subject line so that we know to prioritize that.
And I have a question. Are you recognized also from any UN organizations? So you might be requested via the cluster mechanism. I'm not sure what the cluster mechanism is, but I think they're wondering if you have any affiliation with any UN organizations and or certification outside of the US.
To my knowledge, we do not. We have been an official nonprofit since 2016. And that has not come up at this point. I think we love the term, we are building the plane as we're flying it. So we have not had a chance to connect with anyone from the UN. We're hoping that maybe this request to join this group in DC in a couple of weeks will give us the opportunity to have conversations about that. But if anybody is interested in us being part of something like that, again, please reach out to us and we'd love to have a conversation with you.
Wonderful, thank you. And if anyone here is part of any sort of UN organizations, you might be able to send an email and make a connection as well, which would be really helpful. I think that is our list of questions. If I was able to keep up in regards to your presentation, definitely there were lots of comments in the chat that
I have one last question now that I'm thinking of.
Yeah, please.
Do you have any research activities in child life disaster relief?
That is a great question. We we don't currently have any specific about the work that we do in child life disaster relief. We are, if you know of anybody who would like to do research for us and with us, we are definitely looking for someone to do that. As I was saying, that the organization, our child life specialists who, you know, kind of their first primary role is to be a child life specialist in a medical setting or a different setting, and then they volunteer their time. So it's been difficult for us to be able to do our own research. We desperately, desperately would love to have that. So yes, anybody on this call who is a research bug, contact us. We would love to work with you.
All right. Well, folks, if there are no more questions, thank you so much again, Toni Millar. I hope this has been a real wonderful introduction for all of our colleagues who have not worked with child life before, and a wonderful affirmation for our guests who are child life specialists interested in disaster. Folks, we need you. Keep up your good work. And we'll put again in the chat how to get in touch with Child Life Disaster Relief. And again, this lecture was hosted by the World Association for Disaster and Emergency Medicine Pediatric Disaster Medicine Special Interest Group. And we encourage you, speaking of research, to submit your abstracts for the WADM Congress in Tokyo 2025. And we hope that we will see you and some of you child life specialists there.